Good morning, and thank you for tuning in to the Miracle Marathon benefiting Children's Wisconsin 26th Annual. Dave and Doreen broadcasting live from Children's. And joining us now is Bridget Clementi. Bridget is the Vice President, Community Health here at Children's. Bridget, thank you for joining us. We appreciate it.
Good morning. Thank you.
Shocking statistic here for people. Children's is known for like your clinical care, amazing clinical
Yes.
care. You take your child to the doctor, to the clinic, whatever.
Mm-hmm.
And Bridget's here to tell us that clinical care only accounts for 20% of a child's overall health and well-being.
Yeah.
How can that be? Only 20%?
How can that be?
Yeah.
It's amazing.
What is the other 80%?
Yeah.
All different types of things that affect life each and every day. The environments that you're in, the social connections that you have, the relationships, the places and time that you spend in school and in your community. Those are the things that affect our health. And they can affect it positively or they can be barriers to our health. And so it's important that we understand that while the clinical care that happens here is amazing, there's no way that Children's can reach our vision of Wisconsin's kids being the healthiest kids in the nation without really thinking about services and programs that reach far beyond those clinical walls.
Well, if you think about it, kids don't come, with a manual when you become a
Mine
parent.
didn't,
No,
for sure.
they hand you the baby,
Yes.
and then you're to figure it out on your own. And some people just
Isn't that
No,
like the
don't
scariest
know.
ride home
Oh
too?
my
Like,
God, yeah.
Okay, like when you put your brand new baby in the car and you're like, wait a minute,
they're gonna let us.
they're gonna
take
let us
this.
take the baby home?
Yeah, by
Like,
ourselves.
are we gonna be able to handle this?
Yeah.
And to that, let's talk about
Yeah.
that, for example. If you've got a child who's here in the hospital, let's say someone who's, maybe your child's undergone orthopedic surgery, you can't just, for example, put them in a traditional car seat to take them home, correct?
Absolutely
And right.
not.
And
Okay.
how do you know that? I mean,
And
right?
you certainly don't want to just put them in the back seat without
No.
any kind of child protection, so to
Can't
speak,
do
for that
that.
ride home.
Well, and if anybody's
Absolutely
tried
not.
to put a car seat in at any point in their life, it's not easy.
So in other words, like that would be one of the many things in a child's overall well-being.
Absolutely.
Okay, so what do you do? In my example of, let's say we have a baby who's had some orthopedic surgery, can't be in a traditional car
Casted,
seat,
right?
casted or whatever. What do you guys do?
So we help to really assess how is the child going to ride home safely? How are they going to ride to and from their appointments as they're coming back here to get their follow-up care? And so then we provide them education. We provide a car seat. We explain how this car seat may be very different than the one that they're using. It needs to be installed in their vehicle and really help them through that process because it's important that they get to the clinical care, but we certainly
Right.
don't want them getting in a car crash on the way to or from, and we want to make certain that that child is riding safely.
Okay, so, and by the way, as a grandparent, I can tell you that even if you've had kids and you have had them in car seats and it's been decades,
Yeah.
guess what? Everything's changed.
Oh, I'm sure.
Okay, so you gotta come here to know exactly what you're doing. But aside from the car seat situation, you guys take care of children in every angle and aspect. We've talked to you about the nursing programs. I mean, school nurses wouldn't be out there in the Milwaukee School District if not for Children's.
School nursing is one of the programs that reaches directly into where kids are spending the majority
Yep.
of their time.
8-9 hours a day.
Absolutely. And you think about when we go back to that 20%, these environments of school, if you're going to school and you don't have your medication, or you're going to school and people around you are not certain what to look for with your asthma attack or whatever the case may be, we really need to make certain that school nurses and the staff and the personnel and the teachers at school are prepared and the kids are really ready to learn. And so we're there to help them through that process. We're there to help them understand what their care plans are. We're there to help educate the teachers and the staff. And we're really there as partners in that child's health and right in the environments that they're spending a majority amount of their time.
And this one I always thought was shocking. When I first met you, when I first started, we were talking about all the programs with the kids in school, and one of them is dental care. And the kids that just don't see a dentist regularly, so what do you do for those kids?
Yeah, absolutely. Sometimes it's hard to a family to access the dental care. And so again, when we think about all the services that we provide and the way that we bring services to a family here when they're in the hospital, we mimic that in the community and really work with community partners to bring those services to the places where kids are spending time, community locations, schools, etc. So right within the school environment, we're able to provide that dental care, that preventative care, that restorative assessment, and really get them connected with any follow-up that might be needed. But sealants and cleanings and those things deliver so that the student can be right back in the classroom ready to learn.
Okay, now we need to once again establish that all of these programs that we are discussing are funded through philanthropy.
Yes.
There's no insurance covering
There
this.
is no insurance
No,
coverage.
I mean, we've talked about this over the years, so many things that we as consumers and those of us who are lay people don't understand, that these things are provided by the hospital to make the experience so much better for the kids and the families, but they're not funded, and that's why we do the Miracle
Well,
Marathon.
and they're not free. I mean, toothbrushes just don't fall from the sky.
Yeah,
Somebody
preemie
has to
diapers
provide
don't-
those,
yeah.
right?
Mhm.
Yeah, the classes that we offer around Triple P and really being able to prepare a parent for the unexpected moments of parenthood. And those aren't free either, We have team members that are trained and experts in really delivering some real strategies that you can use in the moment when your child is having that temper tantrum that you didn't expect in the
Right.
grocery store, whatever the case may be. And we really are able to be partners with parents throughout the entire journey of being a parent.
So what do you want people to know at home about Children's Wisconsin? How is their money going to be used?
Yeah, well, Dave, you said it so well in terms of these are all programs and services that are not covered by insurance. And we really rely on philanthropic communities and partners and events like this to really fund programs and services that matter in the lives of kids and families. And we're grateful for your support and your continued dedication for events like this. And we could not do this work without it.
And this place would not be at the level it's at without our listeners and those of you who are listening right now, without you stepping up to help. And that's where we need you to make the phones ring. We need you to make a difference. This is one of those concrete examples in life where you can literally step up and make a real palpable difference in a child's life.
Yep.
And all you have to do is make a phone call or send a text. It's very easy to do. Bridget, thank you so much. We really appreciate it.
Really appreciate both of you and your listeners. Thank you so much for all the support over the years.
Bridget Clementi. Let's give Bridget a round of applause. Nice job, Bridget.